Hi, this is Dr. Jonathan D. Hall coming to you from Boston with another episode in a thoughtful patient's guide to plastic surgery. Today I'm going to talk about fixing the gauged or the stretched earlobe. Stretching or gauging of the earlobe has been around for a long time and goes in and out of fashion. King Tut had gauges over 3,000 years ago. Stretched earlobes are found in the Maasai tribe in Kenya today, where they are thought to be a sign of wisdom. No matter whether you are a fan of gauges or not, there exist proportions that make a given earlobe more or less attractive. So the problem becomes when you decide to take the gauges out and the earlobe is overly stretched. In my video on creating a beautiful earlobe, we learned that men and women observers both agree that an earlobe is most attractive when the free caudal border is 5 millimeters, and all agreed that the earlobe becomes dramatically less attractive when the free border was more than 10 millimeters. I see a lot of patients in the office that like their gauges in their teens and early 20s, but now that they are in their later 20s and 30s are ready for a change. We all know that true beauty comes from within, but people tend to judge us by our appearance. What different stories that patients have told me include that the gauges no longer fit their image or their stage in life. They can't work in finance or at a casino or in the military when they have gauges. It can limit their ability to get a modeling job. I've had a patient that said she moved to a new town and people were not as accepting. And I've had patients that were simply getting married and wanted to wear normal earrings for the wedding. There is not much in the plastic surgery literature about repairing gauges. A plastic surgeon from England visited a rural hospital in Borneo in the late 1970s and was fascinated to find and report on an unusual custom in surgery. The upriver peoples of Borneo would stretch out their earlobes by hanging rings as heavy as 2 pounds made of copper or brass. This custom was dying out among the younger generation. This was the Kenyah tribe in Borneo, which is in Indonesia. As soon as the hospital was built in 1957, the young and old men and women of these tribes would walk out of the jungle into the hospital and ask to have their earlobes reconstructed. This was so popular that he called this operation the Z-plasty of Borneo and noted that most of the 224 procedures had been done in the early years after the hospital first opened. The numbers of repairs peaked in the early 1960s and tapered off to the point that by the time this doctor from England visited Borneo, only a few patients were still seen each year, as the custom of stretching the earlobes became less popular. Most of the patients were men, but there were several young women from the ages of 15 to 20 who were attending school and found that the elongated earlobes were a nuisance playing basketball. This doctor noted that elongated earlobes were no longer a common sight by the time he visited Borneo, except for a rare visitor to town from deep in the jungle. He speculated that as this custom dies out, so will the Z-plasty of Borneo. So here we can see a photograph of a woman before and after her surgery in the early 70s. And now we're going to travel to the present day in Massachusetts. So here is a man in my office in his 30s who was an instructor at one of the local universities and decided that the gauges and stretched earlobes no longer fit with the image that he wanted to present. It is remarkable how much his stretched earlobes resemble the stretched earlobes of Borneo. Borneo, Massachusetts. So I am pleased to report that nearly 50 years later, the Z-plasty Borneo hasn't died out. Our patient is thrilled to have a normal, attractive appearance to his earlobes again. The Z-plasty of Borneo still has its place even 50 years later, but every stretched earlobe is a little different. It is said that one key does not fit every lock, and there is not one technique that works for every gauged or stretched earlobe. We need to analyze and tailor each stretched earlobe depending on what tissues are available in order to reconstruct an earlobe that is of the right shape and dimensions to be attractive. So let's look at a few gauged earlobe repairs. Here's a woman in her later 20s shown before and again 3 months after repair. This is her right ear, and we've restored a normal appearance to her earlobe. And this is her left ear, again shown before and 3 months after repair. The ear has normal proportions and no longer has the deformity from gauges. And here is a woman in her 20s who had gauges of her ears when younger. She had recently moved to a small town and felt that people were judging her based on the appearance of her earlobes. She is shown before and again 3 months after repair. And here is her other ear, shown before and again 3 months after repair. She's thrilled to have a normal appearance of her earlobes that no longer stand out and call attention. Here's a man in his later 20s with gauges. He has been hired for a new job, but his employer will not let him start to work until his gauges have been corrected. Here he's shown on his left ear before and 6 weeks after repair. And here's the same man in his 20s. He had especially overstretched his right ear, as you can see from the back view of his right earlobe. And you can see his pictures before and after repair. He's not planning to have his ears re-pierced. Here's a nurse in her later 20s with a history of gauges. She no longer liked the look and is also bothered by drooping of the earlobes. She was getting married in 6 months and wanted to be able to wear normal earrings for her wedding. She is shown before and again 3 months after repair. The gauged holes are corrected and a more youthful contour is restored. Here's a woman in her early 30s with gauges. She no longer feels that this fits her image. She is shown before and again 3 months after reconstruction of the earlobe in the office. And here's the other ear shown 3 months before and after repair. Here's a 19-year-old model who looked like a young Audrey Hepburn. The appearance of her earlobes was interfering with her modeling career and limited the jobs that she was able to obtain. She's shown before and again just 6 weeks after a T-plasty repair. The scars are typically at their reddest and thickest at 6 weeks and will continue to soften and fade over the next year or more. She has a beautiful normal contour which has been restored to her ear. And this is the view of her other ear. Here's a man in his mid to late 30s who no longer liked the look of gauges. He's shown before and again 6 months after reconstruction. And here's the same man in his mid-30s with his other ears shown before and again 6 months after repair. Here's a man in his late 20s who looks again a little bit like the Kenya tribe from Borneo, but he no longer likes the look of his gauges. He's shown before and again 4 months after reconstruction in the office. This is another Z-plasty of Borneo. And here's his other ear, and the same man in his late 20s. The surgery is easily done in the office and takes about an hour and a half. We mark the surgical repair, we cleanse the ear with an antiseptic and place a buffered local anesthetic to numb the ear. Layers of dissolvable sutures are used, and then Band-Aids and ointment are applied. The Band-Aids are removed the next day, and I have the patient shower with gentle soap and apply Aquaphor ointment. It's important, as with every earlobe repair, to protect the gauges repair for 6 weeks while sleeping, because the incisions become weaker for the first few weeks and don't start to regain strength until the 3rd week, and then slowly regain strength, and by 6 weeks are 70% of the final strength. So if a patient does not wear Band-Aids at night while sleeping, the ear can pull back and forth against the bed pillow and cause some gaping or stretching of the repair. So today we've learned about fixing the gauged earlobe and how we can restore a normal appearance to the ear. And this has been Dr. Jonathan D. Hall from Boston. Please check our website or call us if you have any questions, and check out my other videos on what makes a beautiful earlobe, fixing the split earlobe, and lifting an earlobe. Thank you.